Good morning, everyone. Welcome to the Zoom webinar room of the UP Vanguard Incorporated. Our webinar registration is still open until 9:50, and we have limited slots left, so please invite your colleagues to be part of this one-of-a-kind discussion during this pandemic. We will be joined by our country's 3 former health secretaries in a forum you have never seen on stage. After that, industry and community leaders will share their perspectives on the nation's health security as a business that involves everyone. This event is co-presented by SMC Global Power, giving you the power to celebrate life, and supported by Inquire Group of Companies, Converge IT Solutions, Philam Foundation, MaxiCare, Live Your Best Life, and Alliance for the Philippines Health and Advocacy. We would like to thank our multimedia partners, Mega Mobile, POP, Inquirer.net, and Philippine Daily Inquirer. This webinar is streaming live on fb.com/PhilDailyInquirer and stay with us until 12 noon for a chance to win awesome prizes courtesy of Smart. Thank you.
social platforms. Have a story to tell? Be an Inquirer reporter with the My Inquirer function. Now that's news anytime, anywhere, always.
Got something you want to share to the world? We got you, fam! We are looking for awesome people like you who want to share content that deserve a spotlight on our site. Whether it's a list of everything you love about catos and doggos, pop culture related artwork, or even
Good morning, everyone, and welcome to the Zoom webinar room of the UP Vanguard Incorporated. Our registration has closed already and we have limited slots, so please invite your colleagues to log in to facebook.com/Philippine Daily Inquirer. We will be joined by the country's 3 former health secretaries in a forum we have never seen on stage. After that, industry leaders and community leaders will share their perspectives on the nation's health security as a business that involves everyone. This event is co-presented by SS Global Power, giving you the power to celebrate life, and supported by Inquire Group of Companies, Converge, MaxiCare, Live Your Best Life, and Alliance for the Philippines Health and Advocacy. We would like to thank our multimedia partners, Mega Mobile, POP, Inquirer.net, and Philippine Daily Inquirer. This webinar is streaming live also at fb.com/PhilDailyInquirer and on the Facebook of Vanguard in awesome prices courtesy of Smart. Thank you. We would like to remind everyone to use the names you used during registration to qualify for reminders for you to enjoy and get the best from this session. Choose a place where you have a good internet connectivity or good Wi-Fi signal and you're free from distractions. Prepare your gadget and use earphones for better reception. Put your gadget at eye level, refrain from moving it around. And lastly, you may send your questions through the Q&A button. Please indicate or identify who you would like to answer the question. And the views expressed by the speakers or other third parties in the UP Vanguard webinars are those of the speakers and not necessarily of the organization or any of its members. Again, good morning. Let us know what you think about the national health security as everyone's business. Please answer the poll as shown right now. Now that your answers are all in, this floor will be opened by the UP Vanguard National Commander, Vanguard Guido Alfredo A. Delgado.
Obviously, we're having some technical difficulty, and the video is not going to be played. We'll let the video be taken care of by technical people. But would National Commander Guido be ready to face and just give us a simple welcome and open this activity, please? National Commander.
Dr. Ken, dare you hear? Sir, I suggest we proceed with the
All right.
discussion already. Thank you very much.
All right. Thank you very much. And I apologize for this problem. My name is Kenneth Hartigan-Go, and will be your moderator for this morning. And I have and of course I need to explain why we're here, no? And by way of an introduction, you see, health security of our nation is a critical topic of these days, no? Not only in our country but everywhere else in the world. But what does it really mean? Are we secured as a nation? Who has the benchmark, and how do we set our standards upon this benchmark? Do we in fact know what's the problem, the root cause of this problem? And can we do better? And who are the actors and stakeholders of this drama? Ladies and gentlemen, in the audience, we have a diverse group of individuals representing themselves and their organization, academe, students, healthcare professionals, the industry, policymakers, security experts, and the general public. And we are live on Zoom in the UP Vanguard Incorporated Facebook, YouTube, and Inquirer Facebook. And it's across the nation and even overseas. I'd like the audience to understand and appreciate that health is everybody's business. That there are 6 interacting building blocks, in fact, within this health system, that by understanding this, we'll be able to figure out what would be the problems that we need to solve, and what are the pains and gains that we have so far. So, I like that. Well, given this introduction, I'd like to uh, give the floor now to the introduction of our panelists. Back to you now, Bel and Deo. Do you have the slide? All right. We put together a number of respectable former health secretaries, no? Dr. Manuel Dairit, whom I have the pleasure of serving briefly when he was Secretary of Health during the presidency of Gloria Macapagal Arroyo. And I remember the days that we were chasing a mystery disease in Taiwan. And that's what I learned a lot from you as a field epidemiologist. And this was an interesting challenge for us at the time. And Dr. Dairit brought a number of reforms into the Department of Health. And after that, he has proceeded to become the director working in World Health Organization in Geneva. This is the headquarters where the World Health Organization is based. No? And Dr. Esperanza Cabral is another wonderful Secretary of Health, although her tenure was very brief. She brings a wealth of experience coming from different sectors. I first met her when she was my professor of pharmacology in the Department of Pharmacology and Toxicology, UP College of Medicine. She brings with her a wealth of experience as a hospital administrator, Philippine Heart Center. She's a specialist. She was a past president of the Philippine College of Physicians, and has been a great advocate for a number of health issues in our country. She served before becoming Secretary of Health. She served for a brief period of time also as the Secretary of Department of Social Welfare and Development. And last but not least, we have Secretary Janet Garin, whom I have the pleasure of serving as Undersecretary way back in 2015 to 2016. And I've not seen a very hardworking secretary like Janet Garin. She, of course, brings a wealth of experience, understanding community, the politics, and how legislation is undertaken. And she herself, like the other two health secretaries, have brought in quite a bit of reforms into the institution. So each of you carry a level of professional expertise. We want you to share with us your perspective of different issues of the Philippine health from history, from current events, and draw some useful prescription for the future. Your wisdom and advice for the next generation will be very important for us to shape what is to come for the future. Now, I'd like to throw in the first question, and in no particular order, and if you can keep your comments brief. You were health secretaries within the last 20 years in the Philippines. What to you were the pains and gains that you have experienced in this complex landscape that we have? So that's the first question to our three panelists. Who would like to go first? Maybe the thorn among the roses, Dr. Dairit, you can go first. If you were to unmute your mic, please.
Okay, Ken, and good morning to everyone. Good morning, SP Janet, and all our friends on in this call. Well, first of all, I was Secretary of Health from 2001 to 2005 under the presidency of Gloria Macapagal Arroyo. Maybe just some brief context. Okay, I came into the organization really at a very turbulent time because it was actually an abrupt transition from the presidency of President Erap and Gloria. And as a result of that turbulence, in fact, when I got into the department, there was a lot of, you might say, anxiety and disarray. Okay, some of it was organizational, because my predecessor, the esteemed Kwasi Romualdez, had actually done a reorganization of the Department of Health during his term. And therefore, when I got in, and you know how reorganizations are, people were very nervous and anxious. And in fact, it was hardly over, the reorganization. To stop that, When we came in, and I came in February of 2001, in May, there was EDSA 3. And the supporters of President Erap actually stormed Malacanang, and we were under siege. And therefore, really, in the face of that question, Ken, what I did really at the very start of my term, particularly for the first 6 months, was just calm down the organization. Okay, get people to feel comfortable, get people to find out where they were, and to listen to, in fact, what people were saying we needed to do. And therefore, my first 6 months was very, very quiet. Now, for every pain, there's a gain. Maybe the first pain I might mention to you was we had a polio outbreak, vaccine-derived polio. And it spread in 3 places in the country. And therefore, that was my first big pain. But for every pain, there's a gain, because we then launched 2 massive immunization campaigns, 12 million children immunized in early 2002, and we were able to stop polio. So I'll stop there, just to give you a context of how it was during my time. You know, I celebrated in February 19, the 20th anniversary of my assumption into office as health secretary. So it was that long ago. But I think the issues that I had then, or the country had then, are very similar to the issues we still face today, and we can discuss that further going forward. Thank you.
Thank you very much, Manolet, Dr. Secretary Dairit, for that insight. Maybe I can call on Secretary Janet Garin for your insights as well.
Thank you very much, Ken. When I joined the Department of Health, of course, it was in the midst of a highly controversial time, because I started as undersecretary and later on assumed the post that my predecessor left. It was a difficult task simply because it's difficult to take over when it's not the end of term of somebody. So the challenge was actually to shift away from the politics inside and outside the office and focus on work. And one of the challenges and the pains that I encountered immediately after that was to realize that there was fragmentation, even among the departments, the bureaus, especially coining PhilHealth, FDA, and the Department of Health. They were working independently from each other. The challenges of course, Yolanda, MERS-CoV, and Ebola was also there. And you had a president who wanted the DOH to immediately deliver programs because his legacy involves public health or health equity. Another pain that was encountered was that basically when you introduce change, it's very difficult for people in an institution, in a bureaucratic institution, to accept that. So you have to do it slowly, but they realized that after 1.5 years in office, with the help, of course, of Secretary Dairit, Secretary S.P. Cabral, all the other USECs and undersecretaries, and the former secretaries and officers of DOH, we were able to allow DOH to fully understand that we have to work as one institution, where PhilHealth and DOH will not contradict each other, but will instead augment each other, and where FDA will be listening not only to the people, but also to the industry, bringing with them the mandate that DOH has.
Thank you very much, Secretary Janet Garin. Ma'am SP, Secretary Cabral, may we ask for your insights, please?
Thank you, Ken. Good morning, everybody. In telling stories about how we became secretaries, I think I might say that was an accidental secretary. I was an accidental secretary of social welfare and development for 4 years. And then I accidentally got moved to the position of Secretary of Health when Secretary Duque was moved to the Civil Service Commission at the end of Gloria Macapagal Arroyo's term. Quasi Romualdez had told me several times before that I will never be Secretary of Health because of my position on reproductive health. So I was the most surprised of everybody when I got called by then Executive Secretary Ermita to say I was moving from social welfare and development to health. Anyway, my experience in social welfare and development was very important to me. In fact, I say that all secretaries of health should first become secretaries of social welfare and development so that they can get an insight into who the people that we should be serving really are. They are the poorest of our countrymen. And so I went to the Department of Health. I knew that the end of the term of the president was coming. I was not going to make any structural changes. I was going to push for the advocacies that I felt were important. The Department of Health is very bureaucratic, and to get just an administrative order signed would take you months if you went through the mills, so to speak. So in my term, I got my administrative orders that I felt important signed within 1 or 2 days. I would do the administrative orders myself if people did not feel up to doing it within the timetable that I set. So that is really one of the pains of working with government. It is very bureaucratic, and many people have to sign on to a simple administrative order. It can take months before you go and get one done, and then it will take another year before this is disseminated through seminars and things like that. And even at the end of that, many people would not understand what the administrative order is all about. Technology was not used very well. Even now, it is not used as much as it should be. And I think that is one of the gains that we are going to get if we start using technology properly and well. Anyway, going to national security and health being a part of national security, I think there can be no state security until the citizens are secure. So really, health security is part of national security. What we are going through today is the pandemic, and this virus is not finished with us yet. Okay? In our country, more than 500,000 people have already been infected with COVID-19, and more than 12,000 people have died. So one thing is very clear. Healthcare is not just essential in our health and economic security, it is essential to our national security as well. This thing was known by leaders all over the world since time immemorial. The Greeks knew it. And George Washington was famously uh, a leader who ordered his troops during the Revolutionary War for American independence against the British. He ordered that his troops be inoculated with the smallpox vaccine. And even though this is information that is not well known, many people feel that this was significant in winning American independence. So I think that we should now look at health security as part of national security in the same way that George Washington did and the Greeks did. In fact, the military should be at the forefront of efforts to monitor and improve population health, if only for the fact that they need a ready supply of healthy recruits and conscripts. In spite of having a law called universal health care, however, universal health care remains a dream. So we are not health secure. Many of us are too intimidated to go to the hospital still, to go to the doctors even. because of our uncertainty as to what the bill we will be presented with is going to be and how we are going to pay for it. So COVID-19 is making painfully clear the connection between public health and national security, and providing us with yet another compelling reason to support universal health care, even as the issues of coverage, cost, and equity attendant to this stare us in the face. Thank you.
Thank you very much, Secretary Cabral, for that wonderful insight. As you can see, ladies and gentlemen, being a health secretary is not all about the rosy, cushy job. It's not about the fine things of dealing with the health issues, but having to take care of balancing health and economics, navigating to the politics and bureaucracy. It's not a glamorous work if you come to think about it, really, if you want to set the fundamentals right. Now, let me ask the three of you panelists another question. Knowing what you know now, appreciating the complexities of our landscape in healthcare, there's fragmentation, there's an issue of health equity, the complexity within the Department of Health, the local government evolution, field health issues, private health sector getting involved. If you had the chance, if you have the opportunity, what would you do differently? Knowing what you know now as health secretary then, what would you do things differently now? And I'd like to hear your honest insights here. Thank you very much. I guess we could get anybody who's ready to answer this question.
You know, that's a huge.
I'm sorry.
Because
well,
you know, we're secretaries in particular contexts.
Yeah.
And I think what people have to understand is that things are evolving.
Sure.
Okay. And therefore, the way you behaved 20 years ago may not be the same way you would behave today. Let me just explain, you know, because when I became secretary, the country was broke. You know, there was one quiet moment where we were in a trip with President Arroyo, and she looked so downcast. And just the two of us, and we talked, and she said, you know, there's no money in the treasury. We're broke. So for 5 years, the Department of Health under my term, we had a budget of 10 billion pesos.
Very small.
Today, what's the budget? It reached 160, 180.
Yeah.
Okay. But having said that, then you have to think about what pieces do you actually have to play with. And during my time, President Arroyo had, you know, she had this 10-point program. And one of them really was addressing the vulnerable groups. And therefore she told me, you bring down the prices of medicine to half prices, bring it down to half. That was the marching order. And in a sense, that's what I tried to do. And through three-pronged attack, we widened the use of generics. It was at that time that Unilab launched RightMed during my term, and I could see the role of the private sector to do this. Number two, we tried to improve the public distribution system for drugs. Sa barangay. That started with us. And actually that became the proof of purpose, the proof of concept for the generic companies from the private sector that then came out. The boutiques sa barangay, they saw that you could make money just with small boutiques as long as there were thousands of them all over the country. And thirdly, we continue to put in place that importation of drugs from India to show it could actually be low. So those were the pieces that I played with at the time. The other piece, PhilHealth. Pincoy Duque, Secretary Duque now, was president of PhilHealth. Our problem was the indigents were not enrolled. There was no enrollment of indigents at the time. Local governments had to do it. And it's very, very erratic and very, very patchy. So, but we expanded it, really with the help of the president herself. 3 billion to cover the premiums of the indigents. 3 years later, with the sin tax law, indigents were covered as far as their premiums were concerned. So if you ask the question, what would you do differently? I would say it depends on what cards you're given. Now, one of my pains was SARS. We were able to control it. Okay, congratulations to us. I mean, we can pat ourselves in the back. But really, if you think about it, SARS-CoV-2 is a very different microbe from SARS. Much, much more contagious, much, much more treacherous. During my term, with the Department of Health working hand in hand with DILG and Department of Foreign Affairs, we were able to stop SARS. You know, I was on the phone every day with, you know, the consulates in Canada and Hong Kong. When people were coming home who had worked in hospitals in Canada and in Hong Kong. And we were able to jump the gun and do the contact tracing that prevented the spread of SARS. But we were that near to disaster because if it had broken loose, you know, our systems would not been able to cope with it. The only hospital, private hospital at the time that, you know, we were working with was actually Makati Medical. And that was because Dr. Matupasi was there as an infectious disease. And she, you know, had that understanding of that infectious disease. And therefore, what I would do differently now, that's a big, big question. When COVID-19 hit, and I might say, we probably could have responded much, much faster. But given the treacherous nature of this virus, you know, I think we would have been overrun as well. But maybe we could have kept the lid much, much tighter. Yeah. It would have grown as fast and as much. But that's just hindsight, you know, and just speculating. And I don't want to second guess the people in government for the response. But standing back and saying, okay, China sounded the alert in October, in December. WHO took its time to declare a pandemic, you know, a public health problem of epidemic of international concern. It took them 2 or 3 weeks for that. There were always delays. And as SP says, you know, there are bureaucratic issues in all of these. If there was command and control, there was only one person that could say, close the barriers, stop the flights, then it would be far, far easier. It's not that way. The world does not operate that way. And therefore, we have to go through the process, and the process actually takes time.
Yes.
Thank you.
Thank you, Secretary Derit. We'll come back to you on that because there are questions about the pandemic management later on. Secretary Garin, your turn now. What topic would you like to pick as an issue that you would like to do differently as a health secretary, knowing what you know now?
Ken, let me take off from what Secretary Manolet earlier said, that there are fragmented and varied responses by all countries. What we are seeing in the COVID pandemic situation is more or less the macro aspect of what we have seen in the Philippines, considering that we have a lot of governors, a lot of mayors, each deciding independently. When I took over as Secretary of Health, it was in the midst of an Ebola scare, an outbreak in West Africa. And basically the biggest challenge that I had was making sure that Ebola will not reach our boundaries. Unfortunately, we have soldiers in Africa who had to come home, and one of them actually had malaria. His appearance was very typical of malaria, the chills, but he had fever. And I realize that within the confines of the Department of Health and as doctors, we understand each other. But there will always be somebody who will not agree with the majority. It's a usual process. It's parts of human nature. And when a person feeds information to the general public that there is an Ebola patient in a certain island in the Philippines, then everything becomes chaotic. And I realize that nowadays, technology has changed things. Where before our challenges was just purely confined on science, now we have the challenge of infodemic, of informing the public, laymanizing the people. And this has happened not only once, twice. This is also currently happening in Ebola, in COVID. This also happened in HIV. And while I was paving way, I entered the Department of Health at the time that it was already, I believe, in the third year of the implementation of the syntax law. And while there was money, which was missing during Secretary Manolet's time, there was also fragmented response. Like we had a lot of LGUs whose leaders were responsible, and willing to cooperate. But there were also some LGUs who had very political situations where they would opt to have programs that can be immediately seen by the general public rather than health investment, because we all know that prevention is better than cure, and investing in preventive the public health measures will actually redound to the benefit of the general public. Another thing was that, well, there was syntaxes, programs in field health. There was the missing link of indigents not being enrolled. And so Secretary Manolet Dairit and Secretary S.P. Cabral started enrolling the indigents. But what did I find out? We have a lot of indigents enrolled in field health, but they cannot utilize their their health financing program. Two things. They do not understand. Most of the time, they don't even know that they remember. So there was, again, a problem on communication. And there were just a lot of institutions, public health institutions, that were not accredited for programs that were actually funded by PhilHealth. So there was a disconnect between health financing, human resource, and accreditation of health facilities. So if you coin all of them, it was a huge task that we started. But the basic thing that we forgot, and as you asked me, what would I do differently as health secretary? I would do all the innovations that I did, but I would put a priority on health communication, because science is not that easy to laymanize. And while we are busy in the four corners of laboratories, hospitals, and conference room doing our tasks and our job, the world is not well. There would be people who would either twist, misinform, or disinform the public, or they probably just another thinking of science. And this is spreading like wildfire, not only in our country, but the whole world as well. So as Secretary of Health and as movers of public health, it will not be enough to work for science. The conference room, the walls should be taken out, and discussions should be laymanized well, and all governments and decision makers should have a firm foot on telling the public who to listen to and who not to listen to. In this pandemic, one of the greatest challenges that we have are varied messages. Is the vaccine safe? Is the vaccine not safe? Is it safe to test? Are we going to die because of COVID? Is it a real illness, or is it just a conspiracy thing? There are just some thoughts that we laugh at as doctors. But if you go out, deal with the people, talk with the barangay captains, talk with the councilors, you realize that sometimes and oftentimes, funny questions that we thought are funny are actually real questions that should be answered. Because whatever we do, however we plan, all of this will not be successful if we don't communicate health well.
Thank you very much, Secretary Janet Garin. Do you underscore the importance of understanding the stakeholders, and listening to them is one most important part of the communications reforms that you so mentioned. Secretary Cabral, this is a very complicated landscape. You've navigated it well. Tell us more about your visions and views. What would you do differently if you had?
Well, as Secretary Garin has elucidated very well, everything is interconnected. So if you ask us, what is the one thing that you are going to do? And what is that one thing that you think is going to make the most impact? There is really no one thing because everything has to be done at the same time in an interconnected manner. As they say, even the fluttering of the wings of a butterfly in the Brazilian jungle is going to affect us here. So even so, let's pick one of them and say, I will pick human health resource as something important that we need to focus attention on. Number one is the human health resource of the departments of health, just not nationally, but also locally, are lacking. But more than the fact that they are lacking, they are maldistributed. So this is really one area that needs to be looked at. I'm looking back at the data that I can remember, and I think that in national government, there are barely 3,000 doctors employed by the national government. This is outside of the hospital system, of the special hospitals, okay, because they are really not part of the employees of the Department of Health, but also play an important role in taking care of patients. But the real organic doctors within the Department of Health is nothing but a bit more than 3,000 people, and maybe about the same number from the local government units. These take care of 70 million people because 70% of the population actually access public hospitals rather than private hospitals, even if they want to access private hospitals because they have this perception that they're going to get better care there. They can't because they don't have the money. So they have to satisfy themselves with going to the public hospitals. And they are served by no more than 6,000 doctors, 70 million people. The figures for nurses are not as bad as that, but still very bad. And even the midwives and other health providers and workers that we have. So we really need to look at the numbers. Why are they not in the national service or in the local government service? Because we don't pay them enough. We don't pay them a decent wage. We don't pay them what is commensurate to the service that they provide. So this is something that needs to be confronted, face, full face. Okay, so that is something. Second is the good health providers who are already in national service or local government service need to be capacitated and trained continuously. As Manolet said, things evolve very rapidly everywhere, but maybe more especially in the health sciences. There are new things that we know. There are new things that we are given that we can use. So in order to be able to use them, assuming that we can afford to, these people need to be constantly retrained, constantly strengthened. Their capacity needs to be constantly strengthened, but more importantly, they need to be constantly motivated. Because if you are in a system where you have been working for the past 35 years and you're just waiting for a few more years before retirement, you're going to say, I don't really care, I'll just coast along. But these are valuable assets to us and they must be motivated to give the best that they can. Corollary to that, it is very important that we recognize that the health system is dual in character and that many people access private healthcare system, the private healthcare system aside from the public healthcare system, and that many in the private healthcare system are only too willing to help the public healthcare system if asked. So this partnership between private and public healthcare system must be recognized as important and must be cultivated.
Thank you very much, Secretary Cabral. I'm going to ask the last question for three panelists. Then we go for a short intermission, and then we will invite our esteemed reactors to come and ask questions or give their commentaries. Now, my last question is, in securing the health of the Filipinos, our citizens, what do you think would be the priority items? In effect, I'm asking you, how do you do a fearless forecast of what Philippine healthcare system will be like in the future? In no particular order again. No? Janet, you want to go first, or Manolet, or Secretary Cabral?
Well,
I'm looking for your prescription for the future. How is it going to look like? Go ahead, sir.
yeah. Well, you know, I think the key really is really better governance all around. Better governance of the health system. We have to have a well-led and well-governed system. And when you say that, that talks about the public sector and horizontally across all public agencies. Meaning to say, health is not just a concern of the Department of Health, it's the concern of all of the line agencies. That's what they call health in all policies. You know, the Department of Transportation has to think about polluting vehicles and stop that. The Department of Environment has to think about the degradation of natural resources and stop that, because all of these affect health. So it's health governance all around. And when you're talking about health governance, when you then talk about public health governance, you actually talk about all of the capacities that are necessary to govern well. And you can't build that capacity overnight, but you have to consistently and diligently build it over time. You talked about the building blocks.
Yes.
They all have to be, as you said, you know, handled.
Yeah.
From the health financing to the human resources to the health information. All of that, the technology. It's putting all of that together. The forecast would be, if we are able to do that, I think we are going to have a very, very strong country. But I think we can only do that if more and more of our young graduates, you know, the brightest ones, actually join the public
Governance.
Because while there's a public-private dynamic, the engine of the country is what the government does. Private sector works under that whole environment of what government does, what policies it declares, what priorities it sets. Therefore, you have to have brilliant minds going into government. And you have to do that consistently, generation after generation, decade after decade. So the brilliant minds are then going to be the theme for your leadership and governance. If we don't do that, we're going to be the same.
Okay.
A generation from now. If, you know, the brightest of our graduates all immigrate, you know, we'll be left with a lot of bright people, but, you know, not enough. Look at what China did. In order to strengthen its economy, it recruited all of its brightest minds from abroad. and gave them places to work in China. And see where they are now. They brought in the brightest minds. That's what we need to do.
Okay.
Thank you.
Thank you, thank you, Secretary Darit. I remember during your time, no, when you were at the WHO headquarters in Geneva, what your major portfolio was building these human resources for health, no, across the world, and you had the fortunate opportunity to see how things are happening around the world, no, and it's really difficult and fragmented, no, but they are best practices, and thank you for sharing that with us. Secretary Garin, go ahead, please.
I have two prescriptions for the future, Ken. First is that health knowledge should not only be limited within the central offices and the central government. It should be inculcated with our local leaders because we are in a devolved health situation. And our people in the grassroots deserve to know. We have regional offices who are not even aware of what's happening in the central office. So there should be a cascade of information and exact accountability in terms of implementation of programs. But the bigger prescription that I have, which I know you're very familiar with, is actually the DOH Academy. I remember consulting Secretary Dairit about this before, and they were, Dr. Ellery Dairit was very enthusiastic about it. What is the DOH Academy? What we have now is a situation wherein many policies crafted in the central office, in coordination with some of the people in the academe, are actually not implementable and not aligned or attuned with what is happening on the grounds. So an academy that was already funded, unfortunately, its implementation was not pursued. We have to have people from the municipal health offices and the city health offices who will start from there. Fresh graduates who are doctors to the barrios, who will now become MHOs, city health officers, later on provincial health officers. And this pool of experts and health practitioners will now be the basic pool of human resource that should be appointed in the DOH regional offices. And from there, as they grow older, bringing with them their vast experience and knowledge of what's happening on the ground, what programs are needed, how to make implementation doable, it will now be the core of people, of human resource that the central office will be hiring. Because as it is now, if you have policies that are not aligned with what's happening on the grounds, then all of this planning, all of this health financing, human resource, and even universal health care will not be implemented simply because we have a lot of policies that are not either not applicable or not doable. In other words, if you have a pool of talent who have passed through even the smallest job of public health, who understands the Filipino community in every corner of archipelago, then your decisions, your inputs, and as you go up and become assistant secretary, undersecretary, and even secretary of health, the guidance, the mentorship, and the principles that you will be imparting to our government, which is the core and the needed adrenaline that should land our public health system, will be based on what has transpired on the grounds. It will not be that easy, but as Secretary Manulet and Secretary SP has said, look at the other countries. Why is it very easy for them to implement preventive health measures? Why is it that in China, when the government said, let's all be tested, then everybody gets tested? Why is it that in those countries, if there's price ceiling in India, in Thailand, even in Vietnam and Indonesia, why is it that everybody else follows? In here, we always have a lot of exceptions. And these exceptions are just examples of why our people will not believe in what the Department of Health advises them. We should act as one voice and one people and let everybody realize that if we politicize healthcare, if we meddle with healthcare, if we look at programs that are pleasing to the eyes, but actually without long-term benefits, then all of us and our future will suffer. One legacy that we can actually leave behind is a public health policy and program where in implementation, we'll always think have given our children and our children's children a safer public health equity and a safer place to exist.
Thank you very much, Secretary Garin. You brought out the key issues together with Secretary Darit, issues of governance, education, connectedness of the value chain, and leaving a good legacy. Thank you very much. Secretary Cabral, your turn now. Secretary Cabral, you're muted, ma'am. Please unmute. Thank you.
Okay. Yes, thank you. I can only agree with Manolete and Janet in what they have said. I am an optimist, so I see that the Philippine healthcare situation is going to improve. I just hope that it improves faster than the rate that it is currently going at the moment. They say that there are only three things that you need for a good system to work. Men, I should say women, are included in that. Machines and money. Okay, and as have been alluded to by Doctors Dairit and Garin, the most important of these are the men. So every night I go to bed praying that the next morning things will have changed, that the hearts of men will be enlightened. I'm like Johannes looking for an honest man. In my case, I'm looking for good men. And I'm looking for many good men because not one person is going to be able to do this. Everybody must work together. So this is our focus now, is to find good and true leaders who will think not of themselves first, but of the country that they are sworn to serve. We need to find other men who are going to help this good and true leader, and we need to find a citizenry that is going to also agree that first the welfare of others come, because when the welfare of others are looked after, my own welfare will be secure.
Thank you very much, Secretary Cabral. All three of you panelists have reminded us of the value of serving the country. And going back to the fundamentals and basic is going to strengthen our health system so that we can deal with this kind of eventualities. Mindful of the limited time we have, I'm happy to stop here for the moment and provide the little intermission for our guests as we prepare for the next stage. We will be calling on our reactors. I encourage our participants to throw in your questions. I see many of the questions are really related more to the pandemic, and we will have time to discuss that later on. No? So back to you now, Belle and Deo, for the next steps.
Thank you, sir.
Thank you very much, Vanguard Kenneth Hartigan-Go, for moderating the first part of our discussion.
Where always.
Got something you want to share to the world? We got you, fam. We are looking for awesome people like you who want to share content that deserve a spotlight on our site. Whether it's a list of everything you love about catos and doggos, pop culture related artworks, or even your own random photos, memes, and funny videos, we'd be happy to see it and share it to the world. Join our award-winning team and be part of our InPop creator community. Got some?
The UP Vanguard webinar series is brought to you by SMC Global Power, giving you the power to celebrate life. And our session today is supported by Inquirer Group of Companies, Converge ICT Solutions, Film Foundation, MaxiCare, Live Your Best Life, and Alliance for the Philippines Health and Advocacy, together with our multimedia partners, Mega Mobile, POP, Inquirer.net, and Philippine Daily Inquirer. This webinar is also live on fb.com/PhilDailyInquirer. Finish a discussion for a chance to win phones and Wi-Fi devices courtesy of Smart. At this point, we shine the spotlight on our stakeholders. These are our community leaders who have made valuable contributions to their respective fields. Coming from a family of political leaders, she is not new to the public service. Shortly after passing the bar, she served in the House of Representatives and now Mayor of Makati City, Honorable Abby Binay. Known as a health advocate who empowers patients across the country, the incumbent president of Philippine Alliance of Patient Organizations, or PAPO, we have Ms. Maria Fatima Gurley Garcia-Lorenzo. And currently the department manager of the Operating Room Recovery Room Complex in the National Kidney and Transplant Institute, past president of the Philippine College of Surgeons, and one of the pillars of the UP Vanguard, Dr. Enrico Ragaza. And last but not the least, a physician by profession, but also known as a researcher with UP Octa and an active leader in humanitarian relief, pride of the UP Vanguard, Dr. Butch Ong. This second part will be also moderated by our webinar lead, Dr. Kenneth Hartigan-Go. Over to you, Dr. Ken.
Thank you very much, Belle, for the introduction of our esteemed panel reactors. I'd like to invite Mayor Abby Binay to be the first to give her reaction. Please share with us your thoughts, insights, commentaries, or even questions to our panelists, please. Mayor Binay, your floor now.
First, I'd like to say that I'm surrounded by mostly doctors in this webinar. I feel like an odd woman out, but I think I will be able to provide some certain perspective because I'm coming from the perspective of an LGU executive. So I agree with all the panelists that in any organization, resistance to change is nothing new. Because they are used to doing the same thing over and over again. I would like to take note the comment of my colleague in Congress before, Dr. Janet Garin. There really is a need of laymanizing health policies, because if they are unable to understand why we are implementing this health policy, people are not receptive to it. I think it's the problem with even in an immunization program. Even prior to Deng Vaxia, they feel that it is unnecessary. So it is, and we're having difficulty in implementing a policy of preventive healthcare rather than curative, because the tendency of Filipinos is it is only when I'm sick will I go to the doctor, but it is not when I'm healthy will I go have a checkup. So it will cost and it also costs more because by the time that you do go to a doctor, it's already bad by the time you go to the doctor. So I agree 100% with Dr. Cabral. Even up to today, I think decades, the problem with the lack of doctors is a decades problem. Even if I pay well, actually I do pay well in my city, even if I do pay well for my nurses, they apply, but it's short-lived, meaning they just go get the experience and then they leave or they go abroad. So I have to retrain my nurses or my doctors all over again. So even up to today, we have vacancies that is available, but there are no takers. It is a very big challenge when you don't have enough doctors to man your health centers. I also find it very frustrating when the DOH imposes policies that require doctors. Like for example, for our vaccination team for COVID, they require a 5-man team, and there has to be specific healthcare providers that should be part of the team. Kulang na nga kami sa manpower. Where do we get that? Are you going to supplement? Are you going to provide us? Will DOH actually that's also my question. Why can't DOH give us, if they do have, but as Doc Cabral said, there are only 3,000 doctor organic to DOH for the entire Philippines. So I'm very frustrated when the DOH will ask us to implement policies and we lack manpower, and we lack the understanding on why we are implementing these health policies. So I also agree that there are certain policies that are not applicable in the ground. I think the DOH also needs to revisit certain policies that cannot be applicable to a 4th-class municipality and to a highly urbanized. We are different. I think the DOH should help more those 5th-class municipalities, 4th-class, and then the highly urbanized, let them do what they want. With very little, with minimum guidance, because they have enough money, they have enough manpower. Let go of these highly urbanized and just keep an eye on them, but don't keep them constricted. But help those that are less fortunate municipalities. Again, I agree with Cong Garin. Let's stop politicizing healthcare. It is all about science. I hope that we will be able to overcome that, because that is the biggest challenge, why it is difficult to convince people to have themselves vaccinated by the COVID vaccine. Because we have politicized the DOH. We have to gain the trust of people that the policy that we are implementing, the vaccination program that we will be implementing, trust us. Trust DOH. That is something that the DOH needs to establish and solidifies, to trust the policies being done by the Department of Health. So that's my reaction for all the 3 panelists. Thank you very much.
Thank you, Mayor Binay. You brought out a number of key wisdom here that the department should understand the local government well, and to understand their different nature, and to, shall we say, downscale some regulation for those that are more mature, so that they could carry on their work without interference, while taking note of those who are unable to live up to the challenges of the standards. But Mayor Binay, I'm amazed, because Makati has a very good model of a local healthcare delivery system. But I also understand that the city of Makati has many sister LGU cities and municipalities all spread out all over the country. I think that could be a wonderful stepping stone, no, to helping these LGUs step up as well.
Well, for the sister cities, we do provide benchmarking or some information guidance, but we also, because they're sister cities, in fact, they come to the hospital ng Makati because we provide free healthcare. So we do provide also some assistance to their constituents that require surgery or require hospitalization in our local hospital. I think that the DOH needs to step up, in the sense that I have to be honest, the LGUs feel a little bit lost. Parang, especially during the time of COVID, we're like, okay, this is the policy, just do it. And we're like, okay, what assistance are you going to give us? Give us some direction. I think it's more difficult in the provinces because they don't have enough infrastructure, they don't have enough manpower there, they don't have enough support. But buti dito sa NCR, in a way, we are lucky as compared to those in the provinces. So we really need, the DOH really needs to help us, empower us for your policies to be successful.
That's a very powerful message, Mayor Binay, and we'll come back to you on this in a while. Let's listen to the other reactors, and please do interact with each other. May I call on Ms. Garcia-Lorenzo, our friend from the Philippine Alliance of Patient Organization. You have the floor now, Ms. Gurley.
Hi, good morning, Doc Ken. Mayor Abby, feel kita. I feel you. Kasi it's true. There were our former secretaries were talking about DOH policies. You know, for the patients, for the patient groups and the patients, sometimes we find it so difficult and quite frustrating because from one secretary to another secretary, policies change. There's no consistency. We're talking to one program manager with one secretary, and then when this next secretary changes, another program manager. So the programs, let's say for cancer, for rare disease, there's no sustainability, there's no consistency. So I don't know if there's something that can be done about this, that the best practices that are already in place, don't change it anymore. But follow through from what the good things that the former secretary has done so that it builds up. We don't have to start from zero again when there's a new secretary. Okay, so another thing that I want to bring up is the importance of universal health care that was brought up. And the pandemic really brought out that the importance of really implementing universal health care, because the likes of Mayor Abby, it was really left to the LGUs to implement the response to the pandemic. So had the UHC been slowly already being implemented, then the network would have been in place. But the problem is during last year's session with the health committee, the PhilHealth president said that they will delay UHC because there's no money. And then now we fear that because of the indemnity fund that is being asked for vaccines, it might further delay again the implementation. Where will they get the money? Where will they get the money for this indemnity fund? So we fear that maybe they'll get it from PhilHealth. We don't know. It's still in Congress. And third, I want to talk about vaccines. You know, we in PAPO, we are going to help DOH spread the word about vaccine, that everybody needs to get vaccine, because really vaccine hesitancy is high, brought about by the Demvaxia controversy. You know, the Demvaxia controversy really, how do I say it? The trust level in the DOH, it really brought down the trust level with DOH. So we in PAPO, when we go around, when we try and convince people to have vaccines, that always comes up. That always comes up. So maybe my question to the panelists is, our esteemed secretaries, is how will we now be able to tell our patients and the people to take the vaccine knowing that there is fear because of the Demvaxia? Thank you.
Thank you, Ms. Gurley. That was probably a very strong statement as well on recognizing the elephant in the room. We'll move on to Dr. Enrico Ragasa, National Chairman, please.
Good morning. Good morning to all the panelists. It's nice to be here. It's nice to see your former teachers look a lot younger than you. So I think you all are aging well, except for me. Maybe because I'm one of those, Dr. Cabral, that is now coasting towards my retirement. So maybe I'll start there. I have a lot of things to comment on, but we lack time. No? From where I'm coming from, first I'd like to correct. Well, I was from NKTI. I'm still with NKTI, but for the longest time, more than 30 years, I've been a part-time government doctor. All right. So this is one uniqueness in our health system that I want to comment on. So now, when I'm nearing retirement, I'm one of those who would like to coast and have a good pension. So I opted to go full time. So I'm now full time. But I'm not full time in NKTI because there are no full time items available there. I was offered a job in Marikina in Amang Rodriguez, where I was also there for a while, for the longest time too, as a part time government employee. And so now I realize the uh, the burden of bureaucracy when it comes to public service and in the delivery of healthcare. So Dr. Cabral, Dr. Manolet, and Dr. Janet Garin, you all talked about public health, and I think that's very important. We're talking about national health security. A strong nation is a healthy nation. We know that. We from the Vanguards are reservists. We spent 4 years in ROTC. We were ready to die for our country before, but now I'm too old to do that. So we have the younger ones to do it, but unfortunately, ROTC is not mandatory anymore. And who on earth would like to go on ROTC for 2 years and much more for 4 years? So unless we get legislation for that, no, I'm sorry to say, we will be a weak nation. But this is digressing. So human resources, I think, is very basic. Dr. Cabral really struck the nail on its head when she said that we lack good people in government, in DOH. We have a dichotomy in DOH. We have full-time doctors and part-time doctors. Now that I came from both sides, no, I was part-time for a while, or for the longest time. Now I'm full-time, and I saw that the government is really cheated when you have part-time doctors in government. However, we cannot have full-time doctors. Why? Why? Because we do not pay them well. Again, Dr. Cabral said that. But I think there is a way around this. Why is it that in other countries, especially here in Southeast Asia, we don't have this part-time, full-time thing? We've been to conventions abroad and they couldn't understand this. I tell them I'm part-time. So I'm in government, but I do private practice. I make my money in private practice, but I also serve the government part-time. They couldn't understand the concept. What happens normally is that they spend their early years in government, they really serve in government full-time, they make a name for themselves, then they go to private practice. So I think this is something that has to be looked into by our legislators. Dr. Green is here. Now, when it comes also to processes, you're right. There are a lot of bureaucratic red tape. Dr. Abina is right that I think, I don't know if I can say this, I am a very low, my salary grade is very low in the DOH. I'm a middle-level executive, and my bosses might get mad at me. But I think you're right, Dr. Mayor Binay, that the advanced or the rich, can you put this, no? Those who can afford, should be given more leeway in managing their healthcare system, and that the DOH should maybe have a more central role as a guide. Gurley mentioned, Ma'am Gurley, you mentioned the fact that there's no consistency in government. Actually, there is consistency in government. They just changed the names. That's what I found out. All the processes are there. And mind you, we in government, because I'm still in government now, we still have the public at heart. Well, it's not true that we're just coasting along, ma'am. I'm putting my time. I'm more than 60, I'm nearing 65, and I'm there almost every day in the hospital, going around the hospital and everything. So I see people in DOH really, really working very, very hard. It's just that maybe a little more governance, a little more. The left hand doesn't know what the right hand is doing, if I can say that. No, I don't think we lack money. We are just discussing the billions of pesos that will be spent on equipment, on infrastructure. And again, this should be maybe integrated, because from what I stand, I'm seeing now that public health is given less importance, which I think is very, very important. Coming from a clinician like me, I'm a surgeon, and I love all the toys in surgery, you know, the laparoscopic things, the robots. But I feel when you go to the nitty-gritty of national health security, it's a question of public health. A very good public health system should be the backbone of a very strong health security policy. And I hope we will go into that. I hope those in leadership will go into that. I see Dr. Garin here. Maybe Congress may legislate towards that end. And maybe in your own Republic of Makati, Mayor Binay, you could do this. You have a very beautiful hospital, and I know for a fact that you are building a more advanced hospital to serve the needs of your public. So that's very, very good. So that points me to another very important thing for health security, and this is financing. We could go on and on with financing, but I think it's also very basic, not only human resources. If you have bad financing, where will we all go? I think universal healthcare, the implementation of universal healthcare is something that has to be really looked into. A lot of doctors are not happy. And if the doctors are not happy, the delivery of healthcare services will not be that good. I think the doctors are getting the wrong end of the stick, maybe in the proper implementation of healthcare. We have to ask ourselves, what do we want? Do we want a socialist system where everything is free? There are pros and cons. Or do we want a system that goes towards more private practice? Kaya lang, kawawa naman yung tao, no? Pilipinas, karamihan, mahirap. So I don't think we cannot go there. But maybe we could find the middle ground where both parties will be happy. Now, just one more, Kenneth. And this is close to my heart, yung human resources, yung sinasabi ni Ma'am. And I see Dean Manolet here, no? Yung education natin. We have so many medical schools, Dean Manolet, and I don't really know if we are producing the doctors we were producing a long time ago when Dr. Cabral used to shout at me. Mabait ako, ma'am, mabait ako. So, mabait ako. I'm a good student. So, a good education, a good background. I am just a bit disappointed, no? COVID should have been the best arena for our medical students, for our young doctors, to really get into the nitty-gritty of doing public service and also being exposed to COVID. You know, for example, Dr. David said that he was there during SARS. You know, the guys that were very good in COVID right now were the doctors who were training in Singapore and Hong Kong during the time of SARS. And those were the doctors who were able to really put things into order when the pandemic hit us. Now, siguro years from now, I don't know if our graduates can say na, you know, we are trained in COVID. What's the training in COVID? It's not face-to-face, it's online. No, you know, I personally feel that a doctor is like a soldier. Kung may sakit, kailangan pupuntahan mo. No? Meron ka naman equipment eh. Government is giving everyone equipment naman para ano. So I think, you know, guys, clerks now are only allowed 2 patients to see. Online pa. So paano na yan? No? Pag nagkasakit ako, I'll be worried kung papagamot ako sa kanya. But this is an aside. And then, number 2, very basic, is our accreditation process. Ken, you know this?
Yes.
You know, we have problems in our accreditation process. We are the only country, I think, in Asia, which allows doctors who are not fully boarded to practice their specialties. I don't know why this is happening. It's beyond my pay grade. No, there is such a thing as kulang ng doktor. So okay na lang, pabayaan na lang natin sila. But it's the unsuspecting public that is put at risk. And a lot of our public don't know this. A lot of my patients are you know, CEOs, attorneys, educated, very well educated. They don't understand the initials after my name. Di ba? So, you know, I asked a Singaporean surgeon, what will happen if this resident does not pass the boards? the certifying boards. Well, he does other things. He doesn't go into surgery. He does not practice. He has to look for other things. So this is the sad fact that we have to implement. Now, I am not questioning who should be doing the certification. Right now, it's the societies, the professional societies doing it. Maybe government should go in. I don't know, but we should have one basic national certification accreditation so that when a doctor practices, you're sure of his credentials. I think, and to sum it up all, I think this health security thing is there's a buzzword now, di ba? Yung whole of government. Whole of government. DOH, DILG, magtutulungan, di ba? DSWD, magtutulungan. Whole of government, that's fine. But I think more than government, national health security is an issue that all citizens must be involved with. So more than a whole of government, I think it should be a whole of nation thing. A whole of nation thing. Kailangan magtutulungan talaga tayo, national health security. Ano tayo sa COVID eh. This was a wake-up call, what happened in COVID. And we found out how inadequate we are to really answer things like this. No? So marami pa dyan, Ken. Marami ka pang pag-uusapan about health security. Andiyan pa yung disasters mo, wala pa yung disasters mo.
Yes.
Ito, pinag-uusapan natin, infectious pa lang.
Yes.
You know, early for your information, no, the Department of Health has a lot of training programs. A lot of our doctors are trained in CBRN, chemical, biologic, radiologic, and nuclear problems. No, but I don't see them in the limelight now. I don't see them. There is a unit in the Department of Health called before it was Stop Death. Now it's the Health Emergency Management.
HEMS.
It became a bureau. But I don't see them. They're not so visible nowadays. So you're right, Girlie. You know, there seems to be hindi naman inconsistent eh. It's just that nag-iiba-iba lang. Maybe this is a Pinoy culture that we want to put our mark on something. Pero nangyayari naman yan, Girlie. Don't worry. Medyo matagal lang, pero nangyayari naman. Siguro we are still not too mature as a government. Katulad sa UK, no? The secretaries come and go. But the civil service, the civil servants, the career officials, they remain. Sana ganun, no? Sana ganun. And we should streamline our processes. Dr. Cabral was right. The bureaucracy is just too much. The number of processes, we have to look into the number of processes that we're going into. So Ken, I don't know if I think I shared too much. I'm just so passionate about health security kasi tumatanda na rin ako, no? Gusto ko, basically dapat itanong natin eh, no? Pag nagkasakit ako, madali ko ba makukuha yung treatment? Siguro tayo, Ken, okay tayo, no? Wala tayong problema, sasaluhin tayo na heart center, kidney, hospital ko, St. Luke's. Pero paano yung ordinary taong bayan? Yun ang problema. Buti nandyan si Dr. Abby, at libre lahat sa Makati. Matagal na libre sa lahat. Hindi pa yata uso universal healthcare, libre dyan sa Makati. So that's very good. So yun lang po. So Girlie, okay naman tayo, Girlie. I think may point ka naman. Yung vaccination, pabakuna tayo lahat. Huwag tayo matakot sa bakuna. Pare-pareho lang yung bakunang yan. Huwag kayo maniniwala sa mga sabi-sabi. Well, thank you, Ken. And
thank you very much, National Chairman, Dr. Ragasa. I'm going to, mindful of the limited time, I'm going to move on now to Dr. Butch Ong, and then later that, open it up for open discussion with our participants. They have posted quite a number of interesting questions, and I will call on them for our panelists and reactors to jointly answer those questions. Butch, your floor.
Yes, good morning. I'm glad to be here. No, I'm very humbled. Amongst luminaries in the healthcare profession. Now, to keep things short, to give way to the myriad of questions already lined up for this webinar, as part of the Okta research group, no, we believe that research is really a part of national security. No? So we should be able to study what we have, study our policies, and study how we implement them. Now, one of the things that struck me here really was the issue on science communication, and I think all the speakers touched on this somewhat, no, and all the reactors as well, no? So Okta has been in the thick of things in the data analytics component of COVID-19. No? So I think we began, I think March, and we started to track down and analyze data from the Department of Health drop data set. No? And there are some instances where government really acted on our recommendations. An example would be during June or July 2020, or last year, when we had the spike in the number of cases. It was an actual surge, no? And Okta was able to report that the surge was really happening with a reproduction number of close to 2 already, no? And it forced a 2-week lockdown. If you recall, a 2-week lockdown at around August, no. But still, no, it was about 3 weeks of waiting, no. So the spike was already happening at around the last week of June, first week of July, and implementation of the MECQ was at August 1, no. Although there was a positive response on the part of government, we are wondering if it was fast enough, no, waiting for 2-3 weeks. Then again, we do have a data lag, no, from the Department of Health, a data drop of about 1 week to 2 weeks. So with regards to the handling of data, to data analytics and science communication, no, we must be able to shorten the timeline between getting the data and getting the analysis and bringing it out to the public, because the public has to know what is happening, no. I have always said in my many interviews these last few months, no, that COVID-19's worst enemy is actually an informed public. So if the public is informed by the proper science, the proper analysis of the trends, they will be able to be more proactive in protecting their families and themselves and their communities, no? So with regards to the, science communication, no, there are many ways to achieve this, no. In the University of the Philippines, where I also teach, we advocate the use of informal science advisors. So these are science advisors which are not part of the decision-making body, but are consulted, like Okta. Okta is being consulted in and out, no, sometimes when there is a need to, no. So going into the future, no, I see healthcare in the country with more informal science advisors, no? And knowing this, no, shortening the time of data collection to transmitting the analysis to the public, for the public's understanding, is shortened, no. Now, with regards to, and finally, you know, I'm also a Department of Health employee with PTAC, no, and with regards to research, no, we believe talaga that the Philippines has a lot to offer with regards to infectious diseases, especially in COVID, and how we wish we could do more research on traditional medical or in our herbal armamentarium, no? So all of these together, no, it's about knowing what we have, employing the right minds. And it was mentioned a while ago that we need to bring the right minds back and to get them to the proper place in government or as a third party informal advisor. No? Get all these bright minds together, no? Come up with policies which are also effective down to the grassroots. As already mentioned a while ago, that there is a gap between policies and the grassroots, which are the LGUs, even up to the class 5, class 4 municipalities, no? So that they will understand what is going on in this country, so that everyone will be on a single page. So to give way to the questions already lined up, I revert back to Dr. Kenneth. Thank you for your time.
Dr. Buchong, thank you very much, our panel of reactors, for your insights, commentaries, and very candid comments and some of the prescriptions. So, this is a time where we open the floor to our audience, and they have included their questions into the Q&A box. There are many of them, but I'm going to integrate them and then ask maybe 5 questions in succession. So I open this up to the panelists and to the reactors for you to choose what you want to answer. So let me rattle off, list off what are these questions so that you can prepare how to answer them. No? The COVID pandemic, we understand this is an evolving complex scenario, surface our fragile Philippine health system. How are we performing in the management of this pandemic? How can we improve? Please include vaccine management. So that's the first question. Please think about it. Who wants to answer this question? An assessment of COVID pandemic management and our fragile Philippine health system. Second question. How do we prevent this from happening in the Department of Health? Personality-based governance as opposed to institution-based governance. I think this alludes to what Dr. Ragasa earlier mentioned about changing the guard, and the civil service rank and file will still continue the work that the department should be doing. So that's the second question. How do we prevent personality-based governance from institution-based governance? Third question, do we have an overarching health system architecture to integrate what we've just said this morning? The fourth question, is the Dengbaxia situation a national security threat? How so? The last question is with reference to Mayor Binay's suggestion that the Department of Health leadership should address urban LGU and less fortunate LGU differently. The question is, how can Department of Health execute this and make it happen? So 5 questions. I leave it to the panelists who would like to step up and take one question and answer them. Any volunteers?
Well, maybe I can say something about how we are performing in the COVID pandemic.
Yes, Dr.
Ken?
Cabral. Yes, ma'am.
Yeah. Well, they always say that they are doing their best, and I cannot question that. I'm sure they're doing their best. Unfortunately, at the moment, it does not seem to be good enough. Everywhere in the world, you will find countries that have done better in dealing with the COVID pandemic than the Philippines. Of course, everywhere in the world, you will also find other countries that are not doing as well as we are. But my feeling is we still should be doing better than we are doing. After all, we say that we have bright minds in government. We have many generals, many doctors in charge of the pandemic response. So we expect that we could have done better. Okay? They were asking me to grade our pandemic performance, and I will say that I will give them A for effort. I will take their word for it that they are doing their best. But I'm sorry that I cannot give the same kind of grade for the performance. And one only needs to look at the numbers, and you don't need to believe me. You can look at the numbers, see how we are performing compared to other countries. You can look at the numbers, see how many people have already been infected in the country and how many have died. You can look at the numbers, see whether we have any people who have been vaccinated with the COVID vaccine or not. So this is how we are. I say, okay, you're doing your best. Please do it faster and in a more widespread manner.
Thank you very much, Dr. Cabral. Your perspective are very balanced, and it's a wake-up call. Thank you for that comment. The rest of the panels and reactors, would you like to take on some of the other questions, please?
Yes, Ken.
Yes, ma'am. Dr. Garin, please.
Yeah, thank you very much, Ken. Secretary Cabral was right. Everybody is doing their best. Unfortunately, there's a missing ingredient. They have to align. We cannot have the best experts and the best people working independently from each other. And I believe that's where our fragmented response is anchored up. there was a question in personality-based decisions versus institution-based management approach. That is true. And hearing everybody now, I believe on the part of us legislators, it's very important for us to legislate. I believe it should not have been legislated in the first place, but I believe it's needed because we see a lot of reorganizations. We are seeing undersecretaries, assistant secretaries, directors who will be placed in one task at the end of, let's say, half of the year or even less than a year, transferred again to another tasks. We are seeing a lot of experts being placed in warehousing and logistics, a lot of doctors and medical personnel whose expertise and knowledge cannot be used because they are in a non-medical task. And this should be prevented. It's not only in the Department of Health, but if we compare the Philippines to other countries, in other countries, secretaries come and go. That's why they are called casual officials. But in the Philippines, every time a secretary comes, he brings or she brings with him, not all, but let's say 50% of our appointed officials would bring their own team, replacing vital people. So the learning process is a huge slap to the organization because there's no continuity of programs. So we should follow what all the other countries are doing. While secretaries come and go, the institution remains firm simply because career and experts, technical experts are not changed. And to the comment of Mayor Abby Binay, who's very bent on delivering health, and especially health equity and preventive health care to her constituents, she's talking about the elephant in the room. Sometimes it's very difficult for the policymakers within the department to realize that there's no policy that can be applicable to all. Because a policy, they would talk about toilet habits, the good water supply in areas wherein water supply would need millions and even billions of funds. They would need about expertise in areas in very poor municipalities. Just to cite an example, when the accreditation of rural health and city health offices were crafted in PhilHealth, there was one basic requirement, paving way for a less than 5% accreditation rate. And that was because all RHUs and city health offices were required dentists. How many dentists do you have? How much do you have to pay a dentist? So it ruined the whole public health financing program simply because there are a lot of towns who cannot afford a dentist. That's just one example. But basically, Mayor Abby was right. And the bottom line of all of this is that when policies are crafted, there should be enough consultation, there should be people listening and digesting and hearing from the grounds what they need and how can we help them. It's basically the local government chief executives contributing to our country, but our country also looking at ways of how we can help and augment what they're doing.
Thank you very much, Dr. Garin. You've answered actually two questions here. And I wondered if the rest of the reactors and including the other
Ken, maybe I can chime in.
Yeah, Dr. Darid, please go ahead.
Yeah. If I might tie up questions 1, 2, and 4.
Okay.
The COVID, the personality and the institutionalization and the Demvaksha.
Yes, sir.
You know, a lot of this really has to do with the collective response. How do you improve a collective response? Whether as a bureaucracy, the Department of Health, or as a government, across different line agencies. And when you think of that, there are mechanisms for that. There are institutionalized mechanisms, which can be very, very cumbersome, as SPS mentioned. And then, of course, there's the personality. Really, what you want to do is to be able to get the best of these things, because you need to get a good personality out there moving the institutionalized responses. And essentially, the question is, how do you get to do a better job when you're doing COVID, or for example, even Demvaksha. Because in the end, what you're up against is really an environment that is very, very expectant of good results, very, very critical, and very, very suspicious. You know, very, very suspicious that there's corruption going on, that there are deals and hidden agendas. So the question is, how do you improve that collective response? And it starts again with the people at the helm, but you know, as Mayor Abby said, you need whoever it is that's relating to Makati. Okay, the person in the regional office there that's going to deal with your city health officers and the local governments. You can't rely on Duque all the time, or one or two undersecretaries who are out there in media. The whole bureaucracy has to be moving quietly, effectively. That's the galvanized response. That's really what we need. It's not one silver bullet, one face in the video or in TV.
Yep.
It's people understanding what they need to do and moving it forward under a common vision and agenda. That's really what we need to do a better job.
Thank you very much, Dr. Derit. That's a very powerful prescription, and quite necessary now, no, in this difficult, ambiguous time. I guess we have the last question that I'd like to throw to the panel and to the reactors. Do we actually have an overarching health systems architecture to speak of if we are to move forward for a better future for the country?
As of this point of time, Ken, we don't have. We have a lot of people planning, we have a lot of people contributing. But if you look at the actual situation, it's highly fragmented. And earlier you asked about COVID response. Yes, everybody is working hard. But basically what is pulling us down is that every decision that is being made is a knee-jerk reaction of what the public think. It's not scientifically crafted in resolving the pandemic. It's crafted in such a way, how will the people look at me? How will the people project us? It's playing to the gallery. And that alone is a difficult barrier. It's a big nuance to being successful in terms of public health programs and in terms of coming with an overarching systematic implementation of universal health care.
I would modify the answer there. You know, agreeing with Janet that a lot is fragmented. But I think the overarching framework is actually all of the laws that have been passed, particularly with the UHC law. Look at all of the laws. They're beautiful. We've got at least 20 laws passed over the last 20 years. From UHC, cheaper medicines, syntaxes. That's the overarching framework. What needs to happen is that needs to become made more simple, synthesized, and operationalized, given the different health systems that need to be moving. But it's there. I've looked at all of those laws. If this country could only be rated for the laws that we've passed, we'd be number one. But the thing is, the laws are not implemented as envisioned. And really, part of the reason there, and you know, we also have to be able to, you know, understand the reality, is that the capacity still isn't there. We need to build it step by step. It's not going to happen overnight. Like, for example, devolution in 1992, when I think back to it now, I mean, if I were to rework devolution, I would accept the law in 1992 or 1991. But the implementation plan for that would have taken at least 10 to 15 years. And I would have made a plan to implement that over a course of 20 years. What happened? When they passed the law, they thought they could implement it immediately. And, and everybody got mad, everybody got anxious, everybody said you haven't given us the money. And 20 years later, we're still fighting about devolution. But if, some visionary had said, yes, this is the way to go, but in the language of the UHC law, it's progressive realization. And a devolved system was not going to be realized in 1 year, certainly not in 5 years, not in 10. We're now, how many years after the devolution? We're still struggling.
30 years.
Yeah, but if we had operationalized it and thought through how to operationalize it, put in budgets for it, step by step, I think we'd be in a better place. What happened was that the law was passed, people got angry, and eventually everything became very, very turbulent. I think, as I said, we have a framework, we have the laws. We need to synthesize that, refine it, put it in simple operational terms, and then work out an operational plan to fund it year by year consistently over the course of the next 20 years. That's modernizing our health system. But I think we have the framework.
Thank you, Secretary Deirit. I once asked a question about putting that multi-year budgeting, and I was told that that wasn't possible because of the year-to-year General Appropriations Act, and it changes every year, and therefore it wasn't possible. I remember the late Dr. Alberto Romualdez, popularly known as Quasi Romualdez. He was a Secretary of Health who first got me into the Bureau of Food and Drugs many years ago. And he always said that we're always good in rhetorics, but short on delivery. So I guess it's how we operationalize things, no? And you just gave us a good prescription, Dr. Deirit. I guess we that have been recorded, and many people have asked these questions, wonderful questions. And I apologize that we are not able to capture all your questions in this open forum, but they're listed down here. We will surely share it with our reactors and panelists and get back to you. At this stage, well, I'd like to give you my personal thanks, no? And at this stage, I'd like to pass it on back to our organizers so that we could have a proper closing. Bell or Deo?
Senior Brad Kenneth, sir, I believe we still have time. Maybe some parting words from our
yes, last comments from the panelists and reactors. Sure. Yes. May I start off with Mayor Abby Binay? Do you have some parting words that you want to share with us in today's National Health Security webinar?
I actually hope that we could also consider the Singapore model, wherein people actually invest in healthcare. Meaning, as you said, are we moving towards a socialist of providing healthcare, or do we ask our citizens to be part of taking care of their health? What I mean is, yes, Makati provides for free healthcare services, free hospitalization. But now I'm taking a back step and saying, am I doing the right thing? Why is it that Filipinos are now 100% relying on government to provide for healthcare? Why is it that Filipinos are not investing on their own health? Why is it that the mentality is, oh, when I get sick, I can go to my politician and ask for help. Oh, when I get sick, healthcare, I'm a senior citizen, I am covered by PhilHealth. But why is it that they are not saving to ensure that in case that the insurance does not cover for the entire bill, they have something? Or a small premium, di ba, 100 pesos lang, and yet they find it very difficult. But that is their stake. But they have money to pay for cell phone load, they have money to pay for cigarette, they have money to pay for to buy alcohol, and they buy sin tax, and then they pay sin taxes. But again, maybe this is a collective effort between the DOH, the LGU, and the citizenry. This cannot be done by government alone. We have to help ourselves, especially during COVID. We do have policies, but there are people that are stubborn, or again, they have their conspiracy theories. They believe in false news, misinformation. Let us work together to overcome this pandemic. Thank you very much.
No, thank you very much, Mayor Binay, for that wonderful insights. May I call on Butch, Dr. Butchong? You have any last comments before we come to a close? And of course, we'll proceed to the panelists as well. Butch?
Yes, Ken, Dr. Ken. No, I would like to call on all the scientists and doctors, no, who are involved in healthcare, to contribute, no, to get your voices heard, to get your researches out, to help the country. You know, as I've said a while ago, with proper science communication, with proper research, the collectively we can all go towards one goal. No? As long as the people understand what is going on and what they have. Actually, I like what Mayor Binay said about the why the people don't want to invest in their own health. No? But if we get the people involved, including the scientists and the people involved in their own healthcare, to contribute to the healthcare of the whole nation, maybe we will be in a better place very, very soon. So thank you very much.
No, thank you very much, Dr. Butch Ong. May I call on Senior Brad Dr. Enrico Ragasa for your last comments, please?
Well, as I've said earlier, health security is a whole of nation approach. I think this has been elucidated also by Representative Garin, Dr. Garin, and also Mayor Binay. We have to invest in our health. And I think with the mass media around, tri-media around, it's now easy to communicate this to our people. And Mayor Binay is right. No? You could buy a load, but you cannot pay for your PhilHealth, things like that. No? I have so many patients that I ask them, wala na silang PhilHealth kasi wala na silang trabaho. So they don't want to go out of pocket on this. Now, for those in a position to legislate, maybe Representative Garin could look into this. I think we should put into place more laws that would mandate these things, that we should invest more as individuals to healthcare. And maybe those in positions of leadership, governance positions in our health sector, should look in the way that we are managing our resources. I'm talking about economies of scale, Ken, and you're very familiar with that.
Yes.
Being in the private sector is really
Yes.
an economist, I think. Why can't the Department of Health or government, use these economies of scales to buy equipment that will be the same in all hospitals? I've been to one country. If you go to a public hospital and you're transplanted to another public hospital in the faraway locality, but in the same country, it's like you're at home again. No, the structure is the same. The equipments are all the same. You'll not be lost. But right now, we're not doing that. We procure individually. Individual hospitals procure. Individual governments procure. But why can't we do this centrally? I think this is very not in my pay grade anymore. I think something that our policymakers should look into. But I could see this. I could see the effect down there, because there are if you go to one hospital, one equipment is costing a lot more than another equipment. And I ask myself, why is this so? So isa yun, no? So yun lang naman, no? I think you are right. There are building blocks for health security, but health security cannot be managed alone by government. It's everybody's job.
Okay. Thank you, Dr. Ragasa. Short comment next from Ms. Garcia-Lorenzo, please.
Yes, I just have a very short comment. From the patients, we feel that universal health care should not be delayed, especially in this time of crisis. So please push and implement universal health care now. Thank you.
No, thank you very much, Ms. Gurley. So now we are down to our three panelists. I'd like to begin with Dr. Dairit, followed by Dr. Garin, and then we have the last word from Dr. Cabral. Dr. Dairit, go ahead, sir.
Well, thank you, Ken. Well, maybe just to remind everyone that health is indeed a personal responsibility. And I think we should all remember that. Being a personal responsibility, we still need, as a society, to support each other. And therefore, health becomes a concern of national security. And therefore, we really have to govern better. We have to invest better. And we have to take care of ourselves, of our collective, of our nation better. Personal responsibility has to be linked up with collective responsibility. And we have to do our part in both levels.
Yes.
Thank you.
Thank you very much, Dr. Dairit. Congressman Dr. Janet Garin, please, you have the floor. Janet, are you ready?
Dropped out.
Okay, maybe she dropped out. So we'll reserve the next comment from Dr. Cabral then. Please, Mom.
Thank you, Ken. Just a few words, and I think it sums everything that has been said. Our destiny is shared, and therefore our responsibility must be shared. Thank you.
No, thank you very much for that short comment and insights. Maraming salamat po. No? So I guess Dr. Garin.
Yeah, thank you very much, Ken. And can you hear me now? I think I was muted.
Yep.
Okay, thank you very much. Sec Cabral said everything in a nutshell. It's very easy to criticize, but it's also very difficult to think and realize if we are indeed contributing to health security. And if we don't take care of our health, and if we always believe that it is the obligation of government to cater to everything that we need, as what Mayor Abby Binay said, then we will be doomed. Because while all countries are having a hard time responding to this pandemic, while all countries, some successful, some not really that successful, while everybody's helping to bring us back to normal, we also need to think about how we can contribute in ending this pandemic. Why do we need to practice minimum public health standards? Why do we need to isolate? Why do we need to keep on testing? Why do we need to vaccinate? Because these actions are not geared towards us only. It's geared to protect our families, our community, our country, and the whole world. Thank you very much, Ken, and
Yes.
thank you to UP Vanguard.
Thank you very much, Dr. Garin. So my personal thanks to everybody. I turn now the floor to our organizing secretariat. I think we have some tokens of appreciation for our esteemed guests. Go ahead.
And now we present the UP Vanguard Swiss knife to all our partners in this webinar as a token of our appreciation, and is manufactured in Switzerland using 85% iron and 13% chrome and subjected to 50,000 kilograms of pressure to make a blade that is inoxidizable and able to withstand the toughest environment. We further present a part of the UP Vanguard to our major sponsors who make our webinar series on nation building a reality. This art print is a replica of a heritage piece of the UP Vanguard of an oil-on-canvas composition by Mr. Tam, Austria, commissioned by the class of 1957. Duty, honor, country. This majestic artwork, the original of which has been prominently displayed at the UP Vanguard building in the D. Liman campus, reflects important historical elements and traditions that are engraved within the core of the UP Vanguard. It depicts the heroism of those vanguards who fought and gave their lives in defense of our country's freedom and our democratic aspiration. As the UP Vanguard takes on the digital pivot, today's discussion is the only first of the series. Everybody takes on the challenge of our new normal, and to personally thank the speakers, participants, sponsors, and everyone who made this possible is the UPVI's National Commander Guido Alfredo A. Delgado.
Good morning, everyone. When one thinks of the COVID-19 pandemic, we think of lockdowns, we think of deaths, we think of the vaccines, we think of the jobs and the economy. This is one thing the pandemic is teaching us, and it is teaching us well. The national health security is as important as territorial security. The impact that this pandemic has had on our social and economic infrastructure is so profound that we know things will never be the same again. This is why national health security should be everybody's business. So the UP Vanguards, together with our sponsors led by SMC Global Power Corporation and Inquirer, we are proud to have hosted this webinar on national health security. The first of a series of webinars aimed at bringing to the consciousness of Philippine society the relevant issues of today. And we are proud to have had three distinguished speakers who shared with us their perspectives and views on this issue. Dr. Manuel De Rit, Dr. Esperanza Cabral, Representative Janet Garin, who are all former secretaries of the Department of Health, who brought with them the wealth of their experience and their wisdom that will help all of us shape our own views on how to address the issues confronting us in health today. We also have our distinguished reactors led by Mayor Binay, Ms. Lorenzo, and our brads, Dr. Ragaza and Butch Ong. Maraming salamat for honoring us with your presence today. To the UP Vanguard organizing team of the webinar led by Dr. Kenneth Hartigan-Go and to the rest of the brads, congratulations and thank you. To our collaborating sponsors, Philam Life Foundation, Converge, MaxiCare, SMART, the Alliance for Philippine Health and Advocacy, thank you very much. Lastly, in addition to the timeliness of the national healthcare issue we have chosen to highlight, perhaps as we remember EDSA tomorrow, it is also a fitting time for us to reflect on the other key issues that affect our beloved country. And we hope you will join us as we continue to roll out our webinars on disaster management, energy security, and the new normal on education. For duty, honor, and country, the UP Vanguard will continue to bring these issues to our countrymen. Maraming salamat po at mabuhay ang Pilipinas.
Thank you very much, Vanguard Guido Delgado, the UPVI National Commander. Thank you also to Dr. Kenneth Hartigan-Go for moderating our two-part session. And please don't go away because we'd like to acknowledge our partners and wait for their surprises because we have prizes awaiting for our participants. Thank you.
Tired of missing the latest news? Get the Inquirer mobile app to get the latest stories and updates as they happen. The Inquirer mobile app is an easy-to-use app with quick access to stories and also enhances your experience on other Inquirer platforms. The Inquirer mobile app also lets you recommend stories for the Inquirer front page and share stories on various social platforms. Have a story to tell? Be an Inquirer reporter with the My Inquirer function. Now that's news anytime, anywhere, always.
Got something you want to share to the world? We got you, fam! We are looking for awesome people like you who want to share content that deserve a spotlight on our site. Whether it's a list of everything you love about catos and doggos, pop culture related artworks, or even your own random photos, memes, and funny videos, we'd be happy to see it and share it to the world. Join our award-winning team and be part of our InkPop creator community.
The UP Vanguard webinar series is brought to you by SMC Global Power, giving you the power to celebrate life, and supported by Inquirer Group of Companies, Converge ICT Solutions, Philippine or Philem Foundation, MaxiCare, Live Your Best Life, and Alliance for the Philippines Health and Advocacy. We would like to thank our multimedia partners, Mega Mobile, POP, Inquirer.net, and the Philippine Daily Inquirer. Indeed, hearing from our panelists and reactors was certainly rewarding, but our partners have made this event even more special with these items for raffle. But before we proceed, let me just take one quick group photo with all of our speakers together with our moderator and national commander.
Manulet left already, I think. And, SP.
All right, ladies and gentlemen, please show your best smiles. All right, and we'll be taking our photos now. So thank you very much, Vanguard Delgado, Dr. Kenneth, Dr. Butch, Dr. Richie, Representative Garin, and also to Ms. Gurley and Vanguard Deo Orpilla. So now we will be proceeding to our raffle with our prizes from Smart and MaxiCare. Allow me to share with you the prizes that we have at stake for all of our participants coming from the various regions of the Philippines and around the world.
Shucks.
So we will be drawing winners for MaxiCare, Live Your Best Life. We have some gift items from them, and the top organizations who will receive this special loot bag from MaxiCare, Live Your Best Life, are coming from UP Los Baños. They have the biggest delegation. And also AMSA, Philippines, and DepEd. We will be contacting you shortly for how to claim your prizes. And we also have some items from Smart, an Oppo A12 with 30 gigabytes RAM plus 32 gigabytes ROM, and different LTE devices with one brand, same speed. Get the Philippines' fastest mobile data network in your pocket as awarded by Ookla in 2020. So again, please wish ourselves luck so that you would have the chance to win all these amazing prizes from Smart and MaxiCare. Over to our raffle committee. All right, I think we're having some difficulty in internet connection, but before that, allow us also to encourage everyone to sign up or do your evaluation after this webinar series. So we have a certification that you can receive to your emails, and you will directly receive that to your registered email addresses. Don't forget to follow the link, that's bit.ly/UPVI_NHS2021 eval, or scan the QR code. And the link to the evaluation form will be available for only 72 hours, and it must be submitted if you would like an e-certificate of participation in your email directly delivered. And your e-certificate will be sent within 20 days after the webinar. And now we're ready for the screen sharing of our partner for the raffle draw. Over to you. Again, we're raffling off 3 Oppo A12 courtesy of Smart and some devices, Wi-Fi devices from Smart. Different LTE devices, one brand, same speed. And now we will be picking our winners for the MaxiCare gift bag. We are loading all of the names coming from the registration list earlier, and now we will start picking the winner for the MaxiCare gift bag. We may now press start. All right, first winner, Robin Acedera. And please comment if you are seeing your names already in our chat box. So our first winner is Maria Tulawan. And we're picking 10 or 18 more names. That's right, 18 more names for the MaxiCare Live Your Best Life gift bag. And again, we're encouraging everyone to make sure that you fill out the evaluation form. The link will be available right after this call or this webinar. And you could go straight to bit.ly/UPVI_NHS2021 or scan the QR code later that we will be showing. So our next name is Luthgard Picard Jr. Congratulations, Luthgard Picard Jr. Please message us. And you are the second winner of our MaxiCare gift bag. Drawing our third winner right now, and we still have more prizes for you guys, so please don't leave our group yet so that you would be able to see your names and we could get in touch with you directly. So while we're waiting for the other winners, don't forget to fill out the evaluation form to get your e-certificate of participation. Next winner is Michael John De Castro. Congratulations, Michael. You just won a MaxiCare Live Your Best Life gift bag. So we're now drawing our fourth winner. And if you could see your names, please chat us so we could contact you directly. Congratulations, Nathaniel Jaire Larida. You'll be receiving your MaxiCare gift bag. Our next winner of the MaxiCare gift bag is Johnson Tan. Congratulations, Johnson Tan. Please message us so we could share with you on how to receive your gift items. Aside from MaxiCare, we still have Oppo A12 from Smart and some Wi-Fi devices also from Smart. So make sure that you also stay with us until we finish this raffle draw. Congratulations, Paula Erica Lapera or La Peña. Paula Erica La Peña. You just won a MaxiCare gift pack. Again, we're announcing that the biggest delegations would receive MaxiCare gift packs as well. That's a UP Los Baños, Department of Education, and AMSA Philippines. Next winner for our MaxiCare gift pack is Joy Delgado. Congratulations, Joy. Next name for our MaxiCare winner is Sherluen Bolito. Congratulations, Sherluen. You'll be receiving your MaxiCare Live Your Best Life gift pack. So I do hope everyone appreciates that we're doing this live to make sure that we are all doing it fair and square for everyone who stayed with us until this time. Again, while we're waiting for the raffle winners, we're encouraging everyone to fill out the evaluation form. You can go directly to bit.ly/UPVI_NHS 2021 eval and scan the QR code later to access the form. For the MaxiCare gift pack, congratulations to Jose Cortez. Congratulations, Jose. Please message us so we could let you know on how to receive your prize. Next winner is Joseph Raul Buizon. Congratulations, Joseph Raul Buizon, for winning the MaxiCare gift set. Again, this event wouldn't be made possible without the help of our generous sponsors from SMC Global Power, Inquire Group of Companies, Converge ICT Solutions, Philam Foundation, MaxiCare, Mega Mobile, Pop, Inquire.net, Philippine Daily Inquirer, and Smart. Our next winner of the gift pack from MaxiCare is Liza Tabinas. Congratulations, Liza. We still have 8 more winners for our MaxiCare gift pack. Next winner is Karen Villanueva. Congratulations, Karen Villanueva, for winning our MaxiCare Live Your Best Life gift pack. Our next winner for the MaxiCare gift pack is Kenneth Tirado. Congratulations, Kenneth. Please message us on the chat box so we can get in touch with you directly. We still have a few more names to be drawn for the MaxiCare gift pack before we proceed to the smartphones given by Smart Communications. Next name for our MaxiCare gift pack is Manfred Gabriel. Congratulations, Manfred Gabriel. And last 4 names for this batch before we proceed on to the prizes given by Smart Communications. Next winner is Aida Imperio. Congratulations, Aida Imperio. If you're in our chat box, please do message us right now. And again, a gentle reminder to all of our participants to kindly fill out our evaluation form so you would receive your e-certificate of participation within the next few days. Next participant to win our MaxiCare gift pack is Dr. Jed Acero. Congratulations, Dr. Jed. And last 2 names for our MaxiCare gift packs. Our 17th lucky name is Dayan Madulid Santiago. Congratulations, Dayan Madulid Santiago. Please message us. And last but not the least, for our MaxiCare Live Your Best Life gift pack. And that last prize goes to Michael Montesilio. Congratulations, Michael Montesilio. And now we proceed to the more awaited prizes from our partners in Smart. We will be giving away 4 Wi-Fi devices. That's 4 Smart Bro devices from Smart Communications. Different LTE devices, one brand, same speed. Only from Smart. first name to receive the Wi-Fi device from Smart is first name or first participant to receive our smart Wi-Fi device is Romulo Ato Jr. Romulo Ato Jr., if you're in the chat box right now, please message us. And congratulations. Smart will directly deliver it to your place. So all of the smart winners will receive their prizes at their doorstep. They will directly deliver it to your homes. Our next winner is Maria Magdalena Villanueva. Congratulations, Maria Magdalena Villanueva, for winning our item Wi-Fi device from Smart Bro. Next name is Denise Macrohon. Congratulations, Denise Macrohon, for winning the Smart Bro Wi-Fi device. Please message us if you're still on the chat box. And I suggest, guys, that you should not leave just yet, so you'd have the chance to win one of the 3 812 Oppo smartphones. I believe this is our last name for the Smart Bro Wi-Fi device, and the winner is Jovi Ann Ricaforte. Congratulations, Jovi Ann. And you just won the last of the 4 Wi-Fi devices from Smart Bro. Again, we'd like to thank Smart for providing these prizes for our participants. And now we move on to our grand prizes. That would be 3. I repeat, that's 3 units of Oppo A12 with 3 gigabyte RAM and 32 gigabyte ROM. We will be drawing in 3 participants, and the first winner is first winner of Oppo A12 courtesy of Smart is Ernesto Reyes. Again, that's Ernesto Reyes. Congratulations to you. And thank you for staying with us until this time. We still have 2 more names to be drawn from our registration list and attendees. If you're all right here, please chat us so we'd know how to contact you. Second winner of the Oppo A12 courtesy of Smart is Monica Sadio. Congratulations, Monica. If you're there in our chat box, please message us right now. And don't forget to fill out the evaluation form following the link at bit.ly/UPVI_NHS 2021 eval, or scan the QR code right after this session. And our last winner of the Oppo A12 from Smart is Michael Kilala. Congratulations to everyone for winning their the prizes from our partners. So again, this event wouldn't be possible without our friends from SMC Global Power, Inquire Group of Companies, Converge ICT Solutions, Film Foundation, MaxiCare, Live Your Best Life, Alliance for the Philippines Health and Advocacy, and our multimedia partners, Mega Mobile, POP, Inquirer.net, Philippine Daily Inquirer, and special thanks to Smart. Once again, we're inviting everyone to follow the link right following this session to fill out your evaluation form and to claim your e-certificate. Please wait for it in your inboxes within 20 days after the webinar. Again, from the UP Vanguard Incorporated, thank you very much for being with us. Don't forget to follow us on Facebook, that's UP Vanguard, and our website at www.upvanguard.org. On behalf of the UP Vanguard again, maraming salamat po at hanggang sa muli, kita-kita po tayo.